think Dr. Collins said it very clearly that, as a public health official, they assign, I think you said, infinite importance to saving one life. And that's precisely the problem. That's precisely how we got so many of the issues that we had with the spike in suicides, depression, these kids who will never, ever catch up in their education and who will never be able to socialize like a normal adult. And I wonder, what can we do to make public health officials consider the bigger picture and not become so myopic?
Well, you're right. We have an opportunity. Many other people were harmed in great ways economically, and kids whose education was interrupted in a very damaging way. One lesson that I certainly can see from this is the fact that we could put blanket recommendations across this incredibly wide, broad, and diverse country that obviously could not have been correct. And yet it's what was done. What we haven't talked about, but which is part of the reason I think this ran off the rails so badly, in many instances made things worse. And I'm talking about politicians, and I'm talking about the media.
Hi, everyone. This is Lad Dilgard. Welcome to another episode of Stand and Speak. You can find me at Lad Dilgard or on YouTube at Stand and Speak. So that was Dr. Francis Collins, the previous head of the National Institute of Health, with some very unsurprising admittances of they didn't know anything and they did the wrong things, which we've gotten a lot out of Dr. Collins here in the last week or two. This is another episode in our series of Trump appointments, cabinet appointments, and other appointments. And today we're going to highlight Dr. J. Bhattacharya, who has been appointed as the next head of the National Institute of Health. So today our fact of the day is that this was just one example of public health officials admitting that what they did was wrong, and it was actually wrong. Nearly everything that they did during COVID, the government, public health officials, they didn't think through. And as the gentleman on some of these videos on Ugly Truths points out, is that they dialed in on doing infinite amount of things to save one life. And that caused an enormous amount of problems, an uncalculable amount of problems all over the place in terms of children's health and businesses and economics and education and everything else. So he's alluding to politicians and the media as the biggest part of the problem, which is absurd, and it was really the hubris and the we can do anything we want because we're science attitudes of guys like Dr. Francis Collins and Dr. Fauci and Deborah Birx and the rest of the gang down there in Washington that failed the population so bad. So now in a real interesting turnabout, one of the biggest targets for Collins and Fauci was a guy by the name of Dr. J. Bhattacharya, and we're going to go through his resume here a little bit. But he, along with Dr. Martin Kulldorff, created something called the Great Barrington Declaration, which was signed by 950,000 scientists and medical professionals in and around, I think, 2020. It was created, and they said, hey, we've got to have a balanced approach. Lockdowns aren't the answer. They're going to do more harm than good. And essentially, their approach to the COVID pandemic was sober, reasonable, and looking back, totally accurate. How did Dr. Francis Collins address that? He said we need to take them down swiftly. We need a swift and immediate takedown, which means malign them in the media, put out misinformation, and personally attack Kulldorff, Bhattacharya, Scott Atlas, and others who spoke out against the dogma. So Collins is coming out now trying to be humble, trying to say, well, we made some mistakes and we didn't think it through and everything. That's bullshit. And that's not going to fly because we remember what they did. Now, here's a little bit about Dr. Jay Bhattacharya, who has just been nothing short of heroic since the beginning of COVID. I didn't know who he was in 2019, but once COVID broke out, I started reading some of the things that he published from his faculty position at Stanford, and I was thinking, okay, this guy gets it. He's reasonable. So he did his undergraduate at Stanford, medical degree at Stanford, PhD, Stanford, and now is a professor of public health policy there. Sounds like a real loser, doesn't it? Sound like a guy that you wouldn't want to trust with public health policy. You know, the guy who's a professor of public health policy has a PhD in it and a medical degree. So they ignored him and maligned this guy. So the bureaucrats, they didn't want any dissension. A guy like Fauci, who's been in Washington for 40 years, he got his medical degree over 40 years ago. Great, 50 years ago. But now he's been in Washington in a bureaucracy in a big government building, and he wants to tell everybody else what to do with the science. And it turns out he's been wrong. Collins was wrong too. They were all part of the same cabal down there.
Alluded to the gentleman should get the vaccine because he will not infect another person if he gets it. And I thought it had been determined that transmission was not something that this vaccine covered. It helped you, but it didn't help with transmission. So
Let me answer that, because I think there's been a lot of confusion. It is certainly true that vaccinated people can get infected and can infect others.
The evidence is absolutely clear that vaccines are safe. They prevent the spread of COVID-19.
In many instances, made things worse. And I'm talking about politicians.
They prevent the spread of COVID-19.
I was vaccinated and boosted, and I still got COVID in February, as did my wife. I don't think we infected anybody else, but we could have. Yeah, collateral damage. This is a public health mindset, and I think a lot of...
So a little more about this Great Barrington Declaration, which Bhattacharya co-authored with Martin Kulldorff. It underscored the importance of protecting the most vulnerable while minimizing societal disruptions like children's learning loss, which the nation feels acutely as a result of pandemic school closures. So this was after some of these school closures had started. Bhattacharya argued that the federal government must focus on better equipping local health system with tools and data rather than imposing rigid top-down mandates. Like here in Ohio, one day the gyms are closed, the next day the nail salons are closed, and then the next day the ball fields are closed. And people are just like, okay, now we're going to close this, we're going to close that. What a bunch of crap. That was DeWine and Husted and Amy Acton just dictating the lives of people, tightening the screws every day without regard of what the return or the negative effects are. The authors wrote the Great Barrington Declaration at the height of COVID hysteria, brutal government responses, censorship, tattletaling, and panic. I just remember Tim Wall's cops walking through a Minnesota neighborhood, shooting kids with paintball guns and screaming at them, telling them to get inside and get off the streets. That's the kind of crap that we lived through with COVID. We're not forgetting Dr. Francis Collins, who's not there anymore, but his replacement, Dr. Bhattacharya, he remembers as well. So now the very organization that maligned Dr. Bhattacharya, he is going to be in charge of. I hope that he gets down there and he cleans house and he finds who the misinformation bureaucrats are, who the people who put the government in front of people's lives, and who did everything wrong during COVID. And if we know anything now, we know that it's not just COVID that they're bad at. They're probably bad at a lot of other things. So the National Institute of Health, and by the way, there was Dr. Collins talking about how some vaccine misinformation just happened to get spread around from those folks down in government of, hey, if you're vaccinated with the experimental COVID vaccine, you can't spread it. So they kept telling us that. We heard it from Rachel Maddow on MSNBC. We heard it from Joe Biden. We heard it screamed at us from public health officials. Many of our doctors told us this. Totally wrong. So they had to admit it once they rolled out and forced all these vaccines on everybody, very unproven. And then the cases and deaths and injuries and hospitalizations went up even faster. And if you don't trust me saying that, go to Alex Berenson's Substack, go back in the true data that was pulled out from the CDC and from state health officials to show that the more the vaccines were rolled out, the less healthy people got. There was nothing about the vaccines that stopped the spread or stopped the virus. It was herd immunity, and the virus eventually kept mutating enough where it's now just a cold virus that's circulating around. Them's the facts. But Collins and Fauci lied to us. Now, the National Institute of Health, just a minute about this, about where Bhattacharya is going to be in charge of, is the primary agency of the U.S. government that is responsible for biomedical and public health research. Founded in 1887, it's now a part of the United States Department of Health and Human Services, which will probably be under Robert F. K. Jr., who was very skeptical of Fauci, very skeptical of the COVID vaccines, and got just about everything right on COVID. NIH facilities are located in Bethesda, Maryland, which is right outside of Washington, D.C., so you know it's a lot of Washington types there, and nearby suburbs of the Washington metro area. They've got facilities in the Research Triangle Park in North Carolina and satellite facilities around the United States. The NIH conducts its own scientific research through the NIH Intramural Research Program, IRP, and provides major biomedical research funding to non-NIH research facilities through its extramural research program. So this agency, NIH, sent money to the Wuhan lab in China to research gain of function of COVID viruses, and then the virus just happened to appear in the Wuhan area and then spread throughout the world, killing millions. So what I hope Dr. Bhattacharya starts to dial in on is, how did that money get to the Wuhan lab? Who signed off on it? We know some of these things, but we've never really litigated how the virus escaped from a lab, which is all but assured, and who was responsible for it. It looks like, from things that I'm reading, they're ready to continue funding of gain of function. That's when a virus is taught to get even stronger. And they show no signs of changing their ways. So why are we sending millions of dollars, even if it's good research and not evil like this is? Why are we sending it to a Chinese lab from U.S. government, from the U.S. taxpayers? Don't we have scientists here? I mean, this is ridiculous. When I first heard about the money going to the Wuhan lab, I'm like, how many other checks are we sending across the world to research stuff that nobody knows anything about? And it's a lot. So their budget is $45 billion. They have 18,500 employees. Their parent agency is the HHS, like I said. And underneath NIH is the National Institute of Allergy and Infectious Diseases, which is what Fauci was in charge of. It's also the National Cancer Institute. National Library of Medicine is under the NIH. So these seem like something a civilized, healthy society would want. Research, medical advancements, the smartest people getting into the room and figuring things out. That ain't happening here. These are bureaucrats making money, getting rich with their pharma friends, and doing bad things to the American people, first by funding a virus that starts, and then by doing the wrong things to address the virus that hurt everybody and has got people still in a panic and doing dumb things. So this is not what U.S. government should be. And maybe Doge, the Elon Musk agency to reduce waste and fraud and spend in the US government should take a long look at the NIH and where its checks are going and what its people are doing, because what I see, I don't see anything impressive. And I'm very glad somebody who is prescient and wise, like Dr. J. Bhattacharya, is going to be in charge of NIH starting next year. So that's all I have for today, everybody. And stay tuned for this continuing series of Trump appointments. And I hope you have a good day. Thank you.